Anticoagulants, also known as blood thinners, are medications that help prevent blood clots from forming. They work by interfering with the blood clotting process, which can be helpful for people who are at risk of developing blood clots, such as those with atrial fibrillation, heart rhythm problem that increase the risk of stroke, deep vein thrombosis, a blood clot that forms in deep vein, usually in the leg, pulmonary embolism, a blood clot that travels to the lung from deep vein clots, heart attack or stroke. These conditions can damage blood vessels and increase the risk of blood clots. There are different types of anticoagulants, each with its own advantage and disadvantage. The most common type include warfarin, heparin, new oral anticoagulant. Warfarin, this is an older type of anticoagulant that require regular blood test to monitor its effect. Heparin, this is fast-acting anticoagulant that is often used in hospital setting. It can be given as an injection or through an IV. New oral anticoagulant, these are newer medications that are taken by mouth and don't require regular blood test. Examples include dabigatran, Baradax, rivaroxaban, apixaban, edoxaban. Anticoagulants can be effective in preventing blood clot, but they can also increase the risk of bleeding. It's important to talk to your doctor about the risks and the benefit of taking anticoagulant before starting treatment. Here are some additional things to help keep in mind about anticoagulants. They are not a cure for blood clots, but they can help prevent them from forming. They need to be taken exactly as prescribed by your doctor. They can interact with other medications, so it's important to tell your doctor about all the medication you are taking. There are several different anticoagulants used for blood sampling, each with its own specific properties and purpose. The choice of anticoagulant depends on type of test being performed. Here are the most common ones: EDTA, ethyl diamine tetraacetic acid. This is the most common used anticoagulant for blood cell counts and differentiation. It works by chelating calcium, which is necessary for blood clotting. EDTA tubes are usually lavender topped. EDTA tubes. Heparin. This anticoagulant works by inhibiting the activation of thrombin, which is an enzyme essential for blood clotting. Heparin tubes are usually green topped. It's often used for coagulation studies, blood culture, and some chemistry tests. Sodium citrate. This anticoagulant works by chelating calcium similar to EDTA, but it also has effect of slightly alkalinize the blood. It's often used for coagulation studies and the blood gas analysis. Sodium citrate tubes are usually blue topped. Acid citrate dextrose. This is a mixture of sodium citrate, citric acid, and dextrose. It's used for blood banking and some coagulation studies. ACD tubes are usually yellow topped.